1 million lives lost in the U.S. during this COVID pandemic, and the real death toll could be higher. In the world's #1 economy and the so-called shining beacon of hope. Why do ordinary people perish with little to no protection? Why haven't the country's safety protocols worked? Why is the healthcare industry booming while people suffer? Janet Mendes, a New York resident, was infected with COVID-19 in April 2020.
I was watching the news in the beginning. They were like saying, oh, don't worry about it. If you contract COVID, we're paying all the bills for you.
But it turned out that the government didn't pay. Her hospital kept sending medical bills from different departments for different procedures and treatments for her, and the total amount approached an astronomical $400,000.
So why am I getting so much large amounts for the hospital? After the New York Times article, St. Luke's froze the account, saying, oh, we're going to review how much you really owe. We're calculating maybe from $6,000 to $16,000 I might have left over.
Janet is not alone. The Medical Billing Advocates of America found that 90% of hospital bills contain at least a minor error.
The healthcare system, it's not made for the people. It's not made to keep you healthy. It's not made to help you in any way. It's certainly not made to help you pay your bills, right? It's a for-profit system.
Hospitals operate on a for-profit basis. By the end of 2020, HCA Healthcare, the country's largest for-profit hospital system, posted a $3.8 billion profit, more than it made the year before the pandemic. And others are getting a slice of the action. Tenet Healthcare, a multinational healthcare services company, made almost $400 million in profit. The University of Pittsburgh Medical Center and the Mayo Clinic also raked in hundreds of millions. It's a gold mine and a cash cow for other healthcare-related industries as well. As employer-sponsored health insurance is exempt from income taxation, 9 out of 10 privately insured Americans are covered by plans purchased by their employers. But as shown in Michael Moore's documentary Sicko, people have to ask whether the scheme is good for employees.
Being that I'm an employee here, my medicine is for free, so that's why I gotta keep working until I die. There are golden years, I can't find them. I'll tell you that.
And for those who have been laid off, not only did they lose their jobs, but they no longer have a social safety net. In 2010, the Affordable Care Act, also known as Obamacare, was signed into law, introducing significant reforms to healthcare policy. 5 years later, almost 90% of American adults had access to healthcare. More and more people can afford to see a doctor. But when the have-nots gain, the haves lose. The United Health Group, the world's largest healthcare company by revenue, reported a $425 million shortfall from health plans sold on the Affordable Care Act's marketplaces in 2015. 2 years later, in 2017, the first executive order Donald Trump issued after taking office was to repeal Obamacare. Shortly afterwards, many insurance companies such as United Health Group withdrew from the plan. Healthcare coverage dropped, setting the wheels in motion when COVID-19 struck 3 years later. Some 14% of Americans didn't seek treatment because they couldn't afford medical care. That is basically consistent with the proportion of people without medical insurance. Insurance companies are not alone in holding back healthcare reform in the U.S. There are, in fact, so many vested interests that the plight of ordinary people takes second place, if any.